Hi, I'm Amanda Olson from IntimateRose.com, and I'm a doctor of physical therapy and certified pelvic floor rehabilitation specialist. And today we're going to talk about how pelvic floor strength and doing Kegels can affect sexual quality and sexual outcomes. So female sexuality is complex, more so than males. Their sexual response tends to be a little bit more simple. Female sexual response is made more complicated because we have different hormones, and that can affect the dryness of the vagina. It can affect how we're feeling. It can affect how the muscles are functioning, especially estrogen. And if you are going through menopause, or you're on the other side of menopause and you're in a postmenopausal state, or you're a breastfeeding mother, you may have recognized that when those estrogen levels are really low, you can experience some dryness in the vagina, and that can make sex feel a little bit more uncomfortable. And so when we are looking at improving the quality, just keep in mind that there are several factors, and that pelvic floor strength is one of them. So the pelvic floor muscles support the pelvic organs, and they contract very hard and oftentimes very fast during orgasm. So there are several studies that show that the stronger those muscles are and the more coordinated they are to sexual stimulus, the more intense orgasm can be, or the better quality it can be for the female. So when we look at what a Kegel is, a contraction of the pelvic floor muscles, where the muscles are going to close and lift up into the pelvic bowl, that activation helps keep the muscles strong, for one, and two, coordinated. So when the brain says go, turn on, the muscles remember how to respond and close. The other thing that does is it improves circulation to those muscles and can help the circulation into the vagina and the organs as well. So by contracting those muscles, kind of like a sponge, when you squeeze a sponge under running water, you're kind of flushing out whatever was in there and accepting new water in. The same thing with blood flow. So when we contract the muscles and relax, we get this nice input and output of blood flow, which is good for the general health of the tissue. And it can help when you are going through some of that, whether you're a nursing mother or on the other side of menopause. Though keep in mind, a good lubricant, a good water-based lubricant like Intimate Rose, Velvet Rose, is always a good idea. Use it early, use it often, and use it in good amounts because decreasing heavy friction is going to make it feel better, and we want to avoid any irritation or pain during intercourse. So the way that a pelvic weight can be beneficial to that is when you're looking at a vaginal weight, that's adding resistance to the pelvic floor muscles. So if your muscles have become weakened after being pregnant or delivering a baby, or if you have issues like chronic constipation, or maybe you have a job where you lift a lot and you're bearing down through those muscles, certainly want to learn how to lift properly and not bear down through them. But using a vaginal weight is one way to help increase the strength of those pelvic floor muscles. Interestingly enough, too, they draw your brain's attention to where the pelvic floor muscles are, because obviously you can feel the weight and you can feel if it's dropping down, and you can learn how to contract against that. That's called proprioception, and it's your brain's ability to recognize where a muscle is. It's the same way that if I put my hand up like this and I close my eyes, I know where that hand is. My brain can sense it. But when the pelvic floor muscles are injured, it can lose that ability sometimes. So using a light vaginal weight, either laying down or sitting up and practicing doing Kegels with those, can be really beneficial. If you are experiencing any vaginal or pelvic pain, the vaginal weights are not going to be a good idea, and Kegels may exacerbate it. So if you are experiencing pelvic pain, always a good idea to see your physician, see your women's health practitioner, and see a pelvic physical therapist who can help with finding the root cause of the pain and helping you to eliminate it. And that's another factor that can interfere with intercourse, of course. So bottom line, the sexual response of females and orgasm has several factors, and increasing pelvic floor strength or having a higher level of pelvic floor strength is beneficial to better outcomes, having better orgasm, and overall better sex for you. For more information, visit intimaterose.com. We have other videos and information available, and you can always email us at support@intimaterose.com.